my name is Dr. Robin Abramczyk, and I'm a holistic dentist in Heath, Texas. And I am here today with Dr. Tom McGuire at the IAOMT in Las Vegas, Nevada. And he is the founder of the mercury-safe dentist.com. He actually practiced biological dentistry for many, many years. And this is actually the largest database on mercury that exists. Dr. McGuire, I have just a few questions I wanted to ask you.
Okay.
So one question is, we know that mercury is very toxic and it's lethal. Can you talk just a little bit about that?
Well, mercury is the most toxic poisonous substance on our planet that naturally occurring. And it is 50% of the amalgam filling. Most people don't know that. And the key is not the fact that it's in the amalgam filling, it's that it's also released from that filling, especially whenever it's stimulated. Even toothbrushing, grind your teeth, eating will release mercury that over time can accumulate in the body and actually cause health issues because it's so toxic. It especially damages the immune system. It does a lot of other bad things, but for the immune system. So anybody that's concerned about their health should pay attention to the fact that they have amalgam fillings. They're being exposed to mercury on a daily basis, continually.
All day, every day.
All day, every day. The amounts will change. If you're stimulating it, like you're brushing it with a toothbrush, here's for example the amount that's allowed by the regulatory agencies in a workplace, the mercury vapor, ranges from 50 to 100 micrograms. If you brush your teeth, you can release, I did a video on it, at up to 260 micrograms, which means that you wouldn't even you'd have to leave that office if you were exposed to that amount. So the American Dental Association says don't worry about it. I say worry about it. You should be concerned about it, and you should find a mercury-safe, mercury-free dentist to remove them safely to protect you while that is happening.
Absolutely. So it is a well-known fact that mercury is very toxic from everyone, from all governing bodies. Why are we still placing mercury? Why is the ADA okay with putting these toxic substances in patients' body even today?
Well, that's a great question, and it's a great question for patients to know the answer to. The ADA has long supported amalgam fillings, and way before, they supported them long before we knew that this mercury vapor was released. When we could prove it, now we can conclusively prove that it's released. Instead of saying, well, we have to stop putting these fillings in teeth, they just said it wasn't enough to harm people, which is not true. So what happens now is that you look at the ADA, they support occupational safe dentistry for mercury. They encourage dentists to protect themselves, the staff, and the environment. But they still say, even though they're concerned about it in the office, they still say that mercury in amalgam fillings is safe, even though it too releases mercury at a higher level than the regulatory agencies allow in many cases. So it's something that it's outdated. There's 3 countries in Europe, Denmark, Sweden, and Norway that have already banned amalgam fillings because it's not a safe filling.
Absolutely.
It's just not. So
Absolutely.
if you're concerned about it, especially for children, because a mother with amalgam fillings can be giving off mercury that can be taken in, and the placenta will be taking up that mercury, and you just don't want to have that happen.
Absolutely.
They're so much more vulnerable, as you know.
Absolutely. Wonderful. I appreciate you so much for sharing with us today. Thank you so much.